Hi, this is Dr. Masters again with Austin Addiction Medicine Associates, and I'm going to talk to you today about advice for friends and families of drug addicts and alcoholics. So I'll be talking to wives and husbands, parents, even employers, and judges for that matter. Because when someone is coming into rehab, you can usually find the footprint of one of those four groups in their rear end. 80% of people are kicked into rehab. The other 20% show up because they're sick and tired of being sick and tired. What's going to help your loved one get into recovery faster? Well, the thing that will help is if you quit enabling their disease. And a lot of times enabling is not well understood. It's basically an attempt to rescue someone from the natural consequences of their behavior and their addiction. So how do we enable people? We bail them out of jail. We bail them out financially. We bail them out with the boss on Monday morning when they're too intoxicated, too hungover, or otherwise too impaired to go to work. These are all enabling type behaviors. Let me talk first about parents. One of the more reflexive things that parents do is they try to nurture and protect their children over time. But there's a point at which nurturing and protecting is really becomes enabling. And as our society has progressed, we have this protracted adolescence that occurs as a result of needing to obtain higher education than was necessary in the past. So, for instance, nowadays people can stay on their parents' health insurance up until they're 26, and people go through a protracted adolescence when they enter college for 4 to 5 years, sometimes longer, depending upon what their path of study is or how dedicated they are to it. At any rate, it's a natural and normal reflex as a parent to want to protect and nurture your child. But at some point, from a chronologic standpoint, that child becomes an adult, usually around 18, but definitely around 21. And, what I would tell you in the setting of drug addiction or alcoholism is don't give them money, all right? Any money that you give them is going to go straight into the syringe or straight into the bottle. If you want to help them out, if you want to make sure that they have something to eat, then take them to a meal or buy groceries for them. But when you give them money, that goes straight into the syringe, it goes straight into the bottle. The other thing is, if you are going to pay for something, pay for treatment, because that is what will advance their healing process that much faster. But constantly bailing them out of jail, bailing them out financially, those kind of things will cause the illness to persist. And it's vital for you to understand that this is not a weakness of character and inability to deal with life, a case of chronic wimphood, or a moral failing. It is a real, live neurobiologic disease. There is genetic predisposition for it in most instances, and the disease is characterized by an obsession with the drink or the drug and the compulsive use of that drink or drug, and the diagnosis is made when your drinking or drugging intersects with trouble. And trouble comes in one of 6 varieties: romance, finance, health, family, work, or the legal system. So if you have a friend, a relative, a son, a daughter, a father, or a mother who is in trouble in any of those areas, and it's related to their drinking or drugging, guess what? That person is alcoholic or addict. The attitude that you have to develop is fostered in a 12-step program known as Al-Anon. Al-Anon is a 12-step program based on the 12 steps of Alcoholics Anonymous, and it teaches 2 core concepts. The first core concept is detachment. And detachment is loving someone enough to allow them to learn from the natural consequences of their behavior and their actions. Anytime you have to practice detachment, it is by definition emotionally effortful, because you have to stand back and allow a situation to occur. And often it's a situation that you are afraid of. The operative word in detachment is detach, and detach stands for don't even try and change him or her. You can't change them. Only the consequences of their actions are going to change them. People get into recovery when the pain of their current lifestyle exceeds the pain associated with doing the work necessary for recovery. The second core concept that Al-Anon teaches is the 4 C's. When it comes to addiction or alcoholism, we didn't cause it, we can't cure it, we can't control it, but we don't need to contribute to it. And how do we contribute to it? Giving them money, bailing them out of jail, bailing them out with the boss, etc., etc. How do you approach the addict or alcoholic when you know that they need help? Well, first of all, you don't do it when they're under the influence of alcohol or drugs. Usually the best time to address this is the morning after, when they're really hungover and they are potentially amenable to hearing the message. And when you sit down with them, it's best if you do it in a caring and businesslike manner. A lot of times the symptoms of addiction involve lying, cheating, stealing, manipulating, and those symptoms of addiction are characteristic of the disease. They don't necessarily reflect character attributes of the person when they are sober. So just as cough, fever, and chest pain are symptoms of pneumonia, lying, cheating, stealing, manipulating, those are all symptoms of addiction or alcoholism. So what I would encourage you to do is to try to detach a little bit from the resentment that you have against this individual for the antisocial behavior that they have displayed toward you, and instead try and think about it in terms of this is a disease over which this individual is powerless, and once they take that drink or drug into their body, they flip a switch in their brain, they activate the phenomenon of craving, and they're off to the races. So when you sit down with them, you want to have an idea of what your solution is going to be. And you also want to have in mind a consequence if that solution is not going to be embraced. Now, I've actually had some personal experience with this in my family, and at one point, one of my sons needed to go to rehab, and he was staying in our home at the time, and we let him know that it was a sober environment, and that, you know, if he got intoxicated, he would have to leave. And so about 2 weeks later, he did get intoxicated, got into an altercation with his brother, and the next morning, my wife and I asked him to, in a very businesslike manner, to please leave, because that was the agreement that we had established at the outset. So what you want to do in dealing with people who are addict or alcoholic is you want to have a boundary that you know exists before you have the problem. That way, when the problem occurs, you can reinforce that boundary. So what we did was we reinforced the boundary, and our son left the house. He went and couch surfed for a while with his buddies near the local college campus, and we stayed in contact. And I was building a fence that summer, so I needed some help, and he came over and we built a fence together. We continued to talk about his issues, and eventually he got into treatment several months later. And that's the other thing that I want to impress upon you, is the need to maintain open lines of communication. But, you know, you need to understand that you want to maintain open, caring, and compassionate lines of communication with the affected person. However, you don't want that person to be manipulating you or exploiting you, because when they do that, that actually contributes to their disease. So they have to be responsible for their actions and their behavior, and you have to maintain boundaries. And sometimes that's very, very difficult to do, because the people that you're dealing with usually know you very well, and they know how to press your buttons, so to speak, to get what they want out of you. And of course, addicts and alcoholics are master manipulators, so it becomes very difficult. You will find solace and support in the 12-step fellowship of Al-Anon. I strongly recommend that you go to at least 6 Al-Anon meetings in different locations before you decide whether Al-Anon is right for you or not. And I recommend that you explore some of the Al-Anon literature, and you know, you can do that by conducting an internet search, and also by going to Al-Anon meetings. They will have Al-Anon literature, and you can, you know, peruse that at your convenience. But I really recommend Al-Anon because it gives you a grounding influence and a conceptual framework within which to deal with a very difficult situation. And as I said before, you know, if you have to deal with this, it's emotionally effortful. But if you deal with it correctly, then if you have to sit next to their jail cell, their grave, or their bedside, you can at least satisfy yourself that you did everything that was reasonable and prudent to do given the situation. And so I usually don't give any specific advice to people who are dealing with addicts and alcoholics other than recommend Al-Anon, and I ask them to make decisions that they will be comfortable with if they have to sit next to the grave, the jail cell, or the hospital bed. Because if those extreme situations occur and you're able to satisfy yourself that you did everything that was reasonable and prudent to do, then even though you may not get the outcome you want, eventually you'll have peace of mind because you'll know that you did what was possible to do. Also, I would emphasize to you that this is a process. It's not an event. It takes time to acquire the cognitive skills and the behaviors associated with recovery. And when I'm talking about recovery, I'm talking about your Al-Anon recovery. I hope this helps. Thank you.